It has now been just over 1 year since healthcare consumers have been protected against surprise medical billing by a new federal law. So how's that working out? What surprises have emerged since the No Surprises Act? Let's find out. I'm Lee Kelso. This is Health Call Online, the place for extended versions of interviews you hear on the Health Call Radio Hour, a weekly broadcast now heard on stations around the country in national syndication. Our guest today is Loren Adler. He's the Associate Director of the USC Brookings Schaeffer Initiative for Health Policy. His research focuses on healthcare economics and policies around insurance markets, provider payment, Medicare, that type of thing. He's testified before Congress as details of the bill were being debated. So, Loren, it sounds like you're the right guy to have this conversation with. We're 1 year into the No Surprises Act. Are consumers being protected to the degree that you and others had hoped?
Sure. So first, thanks for having me. And so I think consumers, the core protections here against surprise out-of-network bills seem to be working as intended. For the sort of core emergency type of services here and in non-emergencies, patients aren't getting the bills. There's at least some data that about 9 million surprise bills have been prevented or haven't happened because the law happened. And that's actually only through September of last year. So, hopefully, presumably that is continuing, for the next several months afterward.
Yeah, 9 million ugly surprises avoided. That is a big deal. So let's explain kind of just a big broad brush for folks who really aren't following this that closely. What protections does this provide? What billing surprises does it avoid?
Sure. So the sort of two buckets of core protections here. So the basic idea is before the No Surprises Act, you could go to the emergency room, even if the hospital might be in your insurance company's network, so they have a contract together. The doctors who treat you in that emergency might not have a contract. And when that happens, the insurance company will pay something, probably, roughly market rates for that service, but then the doctors can turn around and chart and bill you, the patient, for the difference or the quote unquote balance between their charge, or sort of like their list price, think like the MSRP on a car or something like that, and what the insurance company paid. And that can often be thousands of dollars that we're talking about. So the emergency is kind of the sort of canonical example here, but it also might be you schedule a surgery, a scheduled surgery, and the surgeon's in network, the hospital is in your insurance company's network, but the anesthesiologist or the radiologist is not in your insurance company's network. And then the same basic dynamic can happen here. And then the last one is that air ambulances are also you're also protected from this sort of surprise out-of-network bill from air ambulances.
Yeah, I get it. So you're on the table. You have no idea whether that anesthesiologist is in the network and what he's going to charge you for the service. So I get that. You just count on the system to take care of that for you. And that's resulted in an ugly surprise in the past. So that's affecting the income of these anesthesiologists, the radiologists, and all those ancillary specialists that might be involved in your care. How do they feel about this?
Sure. So it's been a mixed bag. I mean, at the end of the day, so it's the law passed at the end of 2020. At the end of the day, the sort of provider trade organizations here at least gave sort of tepid support, or most of them gave sort of tepid support for the law. I think there was sort of broad agreement that surprise bills themselves shouldn't be happening. The other part of this process here is a requirement that the insurance companies make some payment towards the out-of-network anesthesiologist or emergency physician. And in sort of classic congressional fashion, they sort of kick the can they set up this outside arbitration process to sort of determine this for them. And that is where some of the disputes are happening. So there's been some legal cases over this. So they're still sort of fighting on that end of things. And obviously that has important ramifications, both for the incomes of anesthesiologists and for patients, right? Because if the doctors are paid more, that means patients are paying more in cost sharing and in premiums down the line. So, and employers are paying more for their employees' healthcare. So that part is there's still a lot sort of ongoing fights happening over that right now.
Yeah, good point there. Is there a sense that this bill has driven up the end cost of a patient's care yet? Do we have any idea on whether that's happening?
Honestly, we don't have any great data yet, unfortunately, on this. This is something that folks are looking into. The expectation from when the law passed was that it would actually drive down the end cost of care somewhat, basically because this sort of ability to surprise bill or to treat patients who didn't know what your network status is, right? You have no idea whether the anesthesiologist is in your network or not, that was sort of giving those types of specialists extra leverage. And by taking that leverage away, by passing this law, there could be some salutary effects on healthcare costs. That was the expectation. I think it's unclear exactly what will happen. And there's some legal fights going on in the courts right now that are, I think, trying to work in the opposite direction of that outcome.
So if I go in for a procedure and I do wind up with some wild cost that I didn't expect, what's my recourse as a patient? What do I do? Where do I turn? How do I engage? Walk me through that process.
Sure. So the hope is with this law is that the patient shouldn't have to do anything. So I think start there is that the whole idea here is that it will work, right? When you're treated by the out-of-network provider, that all gets dealt with between the provider and the insurance company, and the patient should be none the wiser, right? This is one of these situations where patients had no expectation that this could even happen, right? This sort of sounds absurd that it could happen. That's the hope here. If, however, the patient is getting a bill, really in any emergency situation, is getting a bill from an out-of-network provider, or any time it's sort of an ancillary specialist, anesthesiologist, radiologist, there's a CMS hotline and email that you can reach out to. CMS being the government organization that is sort of administering the program. And also a lot of states have set up a sort of a similar process to file complaints. But honestly, your first recourse probably should be to reach out to your insurance company and tell them, because this is the insurance company has a fair amount of incentive to follow the law here, or else face penalties. So often you can sort of bring it to their attention and hopefully you can get a resolve. But knowing that there are these backstops to file consumer complaints if sort of the right action isn't happening.
So if I'm one of those patients who has no insurance and I'm going to pay out of pocket, is there any protection for me in this scenario?
Not much, unfortunately. So the No Surprises Act really is focused on folks with commercial insurance. So people with Medicare, Medicaid, any of the sort of public programs, they were already protected from surprise bills. And folks without insurance, unfortunately, are still not protected here. There are some provisions that basically doctors have to give a good faith estimate, quote unquote, about what the cost of the procedure will be to uninsured patients. And if that good faith estimate ends up being wrong, there is this process to adjudicate what you end up owing as the patient. But that's obviously not quite the same thing as just being protected up front from this sort of bill.
Yeah, you're not covered by statute. So that's a challenge. Once I'm at the hospital, there is some protection for me. But there's a gap, and that is what happens before I get to the hospital. If I'm on an ambulance ride, I might still get a surprise bill. How did that happen? Explain why that might happen.
That is a great question, and I would say a somewhat egregious exemption from the law. Right? I saw a survey recently that 16% of bills that patients thought were surprises were from ground ambulances. Right. So it's not an uncommon problem here. There's no particularly good reason why Congress exempted ground ambulances. There are political reasons why, and a little bit was just I think the thought that there's only so much that we can bite off in this process. The other sort of quirk here of ground ambulances is that most emergency ground ambulance transports in the country are actually delivered by a public sector entity. So your municipality, a fire department, that sort of thing. So there was a bit of concern from local governments about how sort of their revenue streams might be affected by federal legislation here. But that's one where I think the sort of socialization and learning process here can, I think, hopefully assuage folks that this can sort of honestly redound to the benefit of local governments, given that the private companies tend to charge a fair amount more than the public sector ambulances do.
Yeah, so we're talking about a matter of typically hundreds of dollars in charges as opposed to tens of thousands of dollars in a specialist fee. So there's that difference. I get that. But, the broader issue to discuss when it comes to healthcare, and patients may not be real aware of this, is private equity. So private investors, corporations coming in and buying up medical practices. There's a lot of concern. I'm reading a lot from physicians who are complaining that they think this is having a real negative impact on the quality of care that we receive. What's the Brookings Institute think of all of this?
Sure. So it's definitely been a growing trend, in particular in the specialties that sort of got implicated in this surprise billing debate. So, I think it's roughly 1 in 5 emergency physicians and anesthesiologists work for a private equity company right now. About 10% of the ground ambulance market is private equity. About 2/3 of the air ambulance market is private equity backed. So, this is a pretty big factor and has been sort of taking over dermatology, ophthalmology, and gastroenterology more recently. There are, I think, still pretty open questions on the quality of care effects. We are starting to get more and more evidence that this is increasing the price of care. So there's been a couple studies now that basically when private equity acquires physician practice, that prices tend to go up for people with commercial insurance somewhat substantially. Depends a little bit on the specialty. But we still right now are kind of, I think, trying to figure out what the sort of quality effects are. The only place we've really seen that sort of evidence is in the nursing home space, where there is now some preliminary evidence of pretty bad quality effects of private equity takeovers of nursing homes. But that's kind of the one area where we have that sort of strong, Brookings style evidence, not from us, but that kind of good empirical evidence yet.
So what is the driver here? If I'm running a hospital, why would I outsource operation of my emergency department, a key function of my facility? Why would I outsource that to private investors?
Money. First and foremost, it basically, the sort of standard story here is that the emergency physician staffing company, the private equity one, will go to the hospital and say, look, I know you used to be paying a subsidy to your emergency physicians or paying them directly. If you hire me and don't tell me how to bill patients and commercial insurance companies, you don't have to pay that subsidy anymore. We're better at getting money out of insurance companies and patients than the old company was, so you should hire us. So the hospital has something to gain in this transaction as well. So I think that's fundamentally why it's happening. I personally think we'll see at least a little bit of a reversal of that now that surprise billing is illegal. But obviously we're in very preliminary days of, the law's only been in effect for a year so far.
Yeah, I get it. They don't have that open field to bill and try to recover all that income. So I get that. As a physician, I'm hearing from a lot of doctors who they're near the end of their careers. They want to retire. Their documentation, electronic medical records requirements, all that bureaucracy demands on them has gone up. And they see this selling to private equity as a way to essentially cash out, and can't really blame them. I mean, they've worked hard all their lives. Is this good for patients? Do we know yet? Is this better for patients?
So I certainly understand it from the physician's perspective, right? If you're looking at an office-based specialty, you've put your life's work into this and you've built up a lot of value in this practice, and there aren't that many buyers of your practice. I think, I've heard from older doctors here that it's just, there aren't as many young doctors who are willing to buy the practice in one place, because that used to be kind of the often way you'd, transfer the equity to the younger doctors in your practice and get money out of it. And now sort of your options are sell to a hospital or sell to private equity. A lot of the doctors I've spoke to even have sort of more negative views of selling to the hospital. And there's actually a lot of empirical evidence that has negative effects as well. So, that is an important, I'm thinking of what the other option is here. So, it may be that selling to private equity raises prices and potentially even reduces quality, but would selling to the hospital have just the same effects is I do think an important question here. Certainly, some doctors are going to make the claim that being bought by private equity allows you to make certain investments in your care. And my guess is it does differ somewhat by specialty. Certainly if you look to primary care, a lot of the practices are a lot of the sort of bigger backed practices here are trying to make the claim, at least, that we're giving a more patient friendly experience. We'll answer your emails, that sort of thing, which I don't think you see quite as much in sort of the dermatology space. Mm-hmm. And I think you see far less of when you move to the sort of hospital-based specialties like emergency medicine and anesthesia, where I've heard, I think there's a lot of complaints from the doctors themselves that they're sort of forcing non-competes on doctors that sort of harm them. I think you've heard a few stories from emergency doctors saying that some of these private equity companies, use too many mid-level practitioners like PAs rather than the doctors. And then that may have, plausibly at least, may have negative effects as well.
Yeah. It's a trend to watch, something we need to pay attention to. I agree with that. So let's bring this back around to the No Surprises Act and just generally being a healthcare consumer. If I have a planned procedure, so a hip implant, who knows what, a planned procedure, what should I do ahead of time so that I know what I'm going to pay? And should I just budget for a slight overage, maybe expect a 10% jump over what I expected?
So I think hopefully now this is one of the benefits of the No Surprises Act, is that when you schedule that surgery you're talking about now, you should really just try to make sure that the hospital or the facility that you're going to is in your insurance's network, and the surgeon, him or herself, is in your insurance plan's network. And beyond that, the law itself should take care of the rest. So you don't need to worry that the assistant surgeon pops in the room, what network status they have, or the anesthesiologist who puts you under. And you no longer have to sort of worry about that. As someone who's tried to call and figure that sort of stuff out for when my wife gave birth, trying to figure out the anesthesiologist network status, it was not exactly possible. So I feel happy that consumers no longer have to think about that.
It does feel like progress. I'll give you that one. So what about emergency circumstances? I'm on vacation. There's a traffic accident. My wife is severely injured. I'm called upon to authorize treatment and that kind of thing. What do I need to be aware of there?
So again, now once you're at the hospital, I think you should feel pretty safe now that everything is going to get treated as if it's in network by your insurance company. Let's not pretend that means it's free, right? That's still, if you have a high deductible plan, you still might be paying a lot of money. Mm-hmm. So I don't want to, this isn't a salvo to the entire healthcare system in the US here. But at least you're not worried about sort of these, what can be some of these like super huge out of network bills. But as we also, touched on earlier, the getting to the hospital problem has not been resolved. So there's going to be some question of, and no real way to know, because you just call 911 and the ambulance shows up. There's no way to check anything about that ambulance beforehand. Certainly I've heard of plenty of folks just taking a cab or Uber or Lyft to the hospital when it's not super emergent. Obviously, once it's a heart attack or a stroke, you should definitely get an ambulance.
Yeah, agree with that one. And one last question here for you. If I'm uninsured, if I'm deciding I'm going to go through life and just pay my medical bills out of pocket, I've got a lot of exposure. What's next to fixing that problem?
Sure. So, I think in that case, right, there are now a lot of options to get highly subsidized insurance if you want to purchase, individual insurance that, at least cover some preventative care and sort of protect you on the back end if things get really expensive. Right. That's sort of the Affordable Care Act made that part very affordable, much cheaper anyway. It depends on what your income is. Sorry, if you're lower income, it made it a lot cheaper. Not much if you have higher income. That exists, but otherwise, there's been some transparency initiatives recently where, it's getting a little more possible to look up what a hospital might charge for various services, but it's pretty incomplete and it is pretty hard to really get great information there. So I wouldn't, I think it's still kind of a pretty rough situation for trying to figure out what to pay for care. And really the big risk when you're uninsured is, what happens if something bad happens? You get in a car accident, you have cancer, right? There's something that is going to take a lot of medical care. Those are kind of the real risks that there's not a great way around, honestly.
Anything I didn't ask you we should cover before I let you
go? No, I think that was covers things.
Excellent. Loren, thank you so much. Appreciate your time and expertise.
For sure. Thanks for having me.